Today's class is going to be on maxillary major connectors. So the specific learning objectives for today's class is the definition of major connectors, enumerate maxillary major connectors, function and requirements of maxillary major connectors, description of each of the maxillary major connector, and also indications for each of the maxillary major connector. So by the end of the class, you should be able to answer all these questions. Coming to introduction. This is how a normal cast partial denture looks like. Now, cast partial dentures have various components in them. So the various components include a major connector, occlusal rest, minor connector, denture base with acrylic teeth, and also the direct retainers. What's the definition of a major connector? It is that component of a partial denture that connects parts of the partial removable prosthesis of one side of the arch to the other side of the arch. Now, it's a unit to which all the other parts are attached either directly or indirectly. Coming to requirements of a major connector. The first one is rigidity. Major connectors have to be very, very rigid to support the prosthesis in place. Hence, chrome cobalt is one of the most widely used of all materials for fabricating a major connector. Second is the shape of the material. Half round gives us more rigidity than half pear shaped. Okay? Flat bars also increase rigidity. They increase the bulk as the length increases. Unification. Partial dentures acts as one unit and connects various parts of it. Coming to stress distribution, it distributes functional loads to both the teeth and to the mucosa. Cross-arch stabilization or counter leverage. Now, bracing elements on one side of the arch provide stability to the other side of the arch. This aids in stabilizing the prosthesis against horizontal stresses. It should not interfere with the soft tissues. This is a picture that you see over here where we have done block out in between all the teeth. Hence, the major connector should not get into the embouchure surfaces and impinge the soft tissues. Avoid terminating on free gingival margins. The borders of the maxillary connector should be placed minimum 6 mm away from and parallel to the gingival margins, whereas the borders of the mandibular connectors should be located at least 2 mm below the gingival margin. You should avoid terminating it on the hard structures such as the mid-palatal sutures or the mandibular tori, and avoid terminating on the lingual frenum and the movable soft palate. It should minimize food impaction. It should be unobtrusive. All line angles should be smooth and rounded, and borders should not interfere with speech. Coming to the design specifications, we have basically two types. One is the bar shaped, that is a long, narrow and thick shaped major connector in cross sections half round or half oval or half pear in shape. The thickness of the bar should be at least 6 gauge, that is 4.1 millimeters at its greatest dimensions. The minimum width of the bar should be at least 4 millimeters, but they must usually be wider than this for the adequate rigidity. Coming to the strap shaped or the plate shaped major connectors, it's a long, wide and thin shaped major connectors. The width of the strap or the plate varies from 6 millimeters to 8 millimeters in length of the plate, length of the palate. The thickest portion of the strap or the plate should be at least 22 to 24 gauge, that is 0.64 to 0.1 millimeters. Now let's summarize the various requirements of a major connector. We discussed that they should be rigid, they should not irritate tissues, should not interfere with tongue movements or soft tissues, they should be able to transfer the occlusal load uniformly to the basal bone, should not cause food entrapments, should be self-cleansing, and should be, most importantly, be comfortable to the patient. What about the location? They should be free from all movable tissues, no gingival impingement, and they should not be located on bony prominences like tori. Now, what are the various different shapes of or the types of major connectors we have, especially for the maxilla? We have 5 different types. The first one is a full palatal coverage, okay, or also called as a full palatal coverage major connector. The second one is slightly shorter than the full palatal coverage or less covering the palate, that is a palatal strap. We already discussed what a palatal strap shape is like. Lesser coverage than a palatal strap would be a palatal bar. Now, another type also we have, that is what we call as a horseshoe shaped major connector, and a combination of the palatal strap, that is an anterior-posterior palatal strap major connector. All of these major connectors are used for various specifications. Coming to the single palatal bar major connector, like we already discussed, it should be less than 8 millimeters wide, because anything beyond 8 millimeters would become a strap. So a palatal major connector should be always less than 8 millimeters, but never lesser than 4 millimeters. Okay, it should be located between two halves of the denture. So always avoid going beyond the second premolar or the first premolar region to give a bar type major connector. It should never be too thin, hence making it too thin makes it flexible. So always try and keep it a little bit thicker. It should not be too bulky as well, because if it is too bulky, it is going to interfere with the palatal contours, and that is not going to be comfortable for the patient. Coming to the single palatal strap, more comfortable than a palatal bar, it is mainly given in bilateral tooth supported or short span situations. The strap should always be 8 millimeters wide and confined within an area bounded by 4 principal rests. Very, very important. A single palatal strap major connector for reasons of torque and leverage should not be used to connect anterior teeth replacement with distal extension bases. A U-shaped major connector is slightly different from a palatal strap. This should be used only in situations where there is an inoperable tori extending to the posterior part of the hard palate. Anteriorly, it should be used 6 millimeters away from the adjacent teeth. So these major connectors are mainly used whenever we encounter a big palatal tori which we don't want to operate on, or for any other reasons the patient tells us that they don't want to operate on a tori. They should never be supported by the inclined lingual surfaces of the anterior teeth. Some of the drawbacks are they tend to spread out under occlusal loads. A horseshoe-shaped major connector has a tendency to flex or deform. Hence, it is not a good connector when cross-arch stabilization is required. Coming to one of the most or some of the more commonly used ones are the anterior posterior palatal bar or the anterior posterior palatal strap. Now the same disadvantage of the palatal bar also comes over here. They have to be bulky for sufficient rigidity, which could interfere with the tongue function. Coming to a combination of anterior posterior palatal strap type major connector, some of the more widely used ones is also indicated for class 1 and class 2 situations, that is distal extension denture basis, long span or long edentulous spans in class 2 mod 1 situations and class 4 situations. So you see that they are almost indicated in every situation. Hence, one of the most widely ones used is the anterior posterior palatal strap type major connectors. Combination of anterior posterior palatal strap type major connectors. This is one of the most widely used major connectors. Some of the indications include class 1, class 2 arches, that is also a distal extension denture basis, long span edentulous spaces in class 2 mod 1 situations and class 4 situations. So like you see that this sort of a major connector is used in almost every kind of situation. Now, this major connectors are more of a parallelogram shaped major connectors with an 8 to 10 millimeter strap, that is the vertical straps, and the lateral straps are at least 7 to 9 millimeters in wide. Posteriorly at the junction of the hard palate and the soft palate, and at right angles to the medial palatal sutures. Now, what is an L-beam effect? L-beam effect is when the strength of this design is derived from the fact that the anterior and the posterior straps are connected laterally by longitudinal straps, creating an L-beam effect or a rectangular frame, which makes it more rigid than a U-shaped major connector. So these sort of major connectors, you will not see them flexing or you will not see them moving under occlusal loads. Each strap braces and takes support from another during flexure, like how you see in the picture over here, when the green and the orange straps, they take support from each other. It is like a circular configuration. Now, palatal type major connector or the full palatal coverage major connector is also a very good major connector to use, especially in extensive cases or in cases where you have to treat a palatal defects. Now, they are thin, broad contoured palatal coverage, hence they help to reproduce the anatomical contours and the strengths of the casting. Okay, they have great retention. They also give you indirect retention and the most rigid amongst all of the major connectors. But the major disadvantage of this kind of major connectors is because of the extensive coverage on the palate, you have the patient always complaining of some sort of difficulties during speech or mastication. Now, it covers more than half or more of the hard palate and maximum tissue support it gains from this. Now, the connector of choice is a long distal extension basis, 6 or less anterior teeth that remains in the arch, where great stability and stress distribution is required, and it is not to be used when there is a tori and there is increased retention, and when you require an increased retention. Snowshoe principle, where is what is the most important factor that we gain from these sort of major connectors is something like a snowshoe, okay, which is designed to distribute forces on the entire base area of the shoe. A partial denture should cover the maximum area possible within the physiological limits so as to distribute the forces over a large area. Now, to summarize, major connectors is one of the most important component of a cast partial denture, which connects all the components of one side of the arch to the other. Now, among the major connectors, the strap are the more functionally favorable than the bars. Major connectors should not impinge on the free gingival margins and on any bony protuberances. Maxillary major connectors should be at least 6 millimeters away from the free gingival margin. These are my references. Thank you.